if you have somebody who is sick, keep your own emotions aside. Consider what that person is going through. It doesn't matter how you feel about them. It could be you. Even like, just treat people the way you want to be treated. Again, if you don't know how, ask for help. Ask somebody who has been through that route, who has made it or not made it. Ask them, how did you help this person when they were going through this? I don't know how. Or you tell the person who was sick, if you're a caretaker, hey, Anyo, I don't know how to help you. How can I help you?
Welcome to the show. I am your host, Anyo Fombad, and I spark the hard conversations that challenge questionable cultural and societal norms that threaten the well-being of the African community. And I also share stories about growing up as Africans in Africa and in the diaspora. I strongly believe that normalizing open discussions and sharing experiences, whether good or bad, will not only make you find your voice, but will broaden your sense of purpose and empower others to do the same. So if you have ever tried challenging certain African cultural and societal doctrines, or if you have ever felt like it is about time that we confronted these issues in our African community and do better as a people, or even if you have always been interested in learning about the experiences of other Africans growing up in Africa and the diaspora, then you are in the right place. Welcome to Living African. Hello everyone, welcome to another episode of Living African. Today we will be talking about breast cancer, and that will be in honor of the Breast Cancer Awareness Month, which is October. And I really hope that this topic will inspire and shed more light on so many issues that we have with non-communicable diseases in our community, which includes breast cancer or just cancer as a whole. So I will be giving you a quick intro and also stating a couple of facts which I would really like for you to take note of. So according to the Breast Cancer Research Foundation, breast cancer is the most common cancer in women overall. In 2020, more than 2.3 million women were diagnosed with breast cancer worldwide, and 650,000 women died. Breast cancer is the most common cancer in women both in the developed and less developed world. In 2012, it represented about 12% of all new cancer cases and 25% of all cancers in women. And since 2008, worldwide breast cancer incidence has increased by more than 20%, and the death rate or mortality has increased by 14%. Now, breast cancer is most commonly presents as a painless lump or thickening in the breast. It is important that women finding an abnormal lump in the breast consult a health practitioner without a delay of more than 1 to 2 months, even when there is no pain associated with it. According to the World Health Organization, approximately half of breast cancers develop in women who have no identifiable breast cancer risk factor other than gender, which is basically a female gender, and age over 40 years. Nonetheless, certain factors increase the risk of breast cancer, include increasing age, obesity, harmful use of alcohol, family history of breast cancer, history of radiation exposure, reproductive history such as the age that the woman's menstrual period began and the age at first pregnancy, tobacco use, that is smoking, and postmenopausal hormone therapy. A family history of breast cancer increases the risk of breast cancer, obviously, but the majority of women diagnosed with breast cancer do not know or don't have a known family history of the disease. Though lack of a known family history does not necessarily mean that a woman is at reduced risk. Breast cancer treatment can highly be effective, achieving survival probabilities of about 90% or higher particularly when the disease is identified earlier, which basically highlights the need to be checked as early as possible. Survival of breast cancer for at least 5 years after diagnosis ranges from more than 90% in high-income countries to 66% in India and 40% in South Africa. Early detection and treatment has proven successful in high-income countries and should be applied in countries with limited resources where some of the standard tools are available. So today we will be speaking with a breast cancer survivor who will be here to tell her story. Gwendolyn Ngu is a dear friend and probably one of the strongest people I know. I am super honored to use my platform to share her story, and I hope that she inspires you the same way she has done me all this while. So I just want to welcome you, Gwen. How are you doing today?
I'm doing good. And you?
I am doing wonderful. I am super, super honored to have you on this platform to share your story, especially with those who may not know you or know what you've been through. I would really like for us to dive deep immediately into your story because I know you were very, very active on social media, which, I totally adore. You have like the best photos. I remember the first time I told you, the first time I ever saw you, I was like, oh my goodness, this girl is so beautiful. She's so positive. I just could not get over your beauty. And just the way you carried yourself. And then when I got to know your story, I was super, super amazed at just your strength, So I really look forward to having my audience share in that strength with you and just get to know your story. So just tell us about your story with breast cancer and how you even came to discover that you had breast cancer.
Great. I am glad to be able to share that story with you and your audience. I mean, like you again and your audience. First of all, I am Gwendolyn Ngu, like you said. I am a mom. I am a warrior, a survivor.
Yes.
And more.
Yes.
All right. Well, I was 27 when I got diagnosed. I remember I was taking a shower one day and I felt a lump on my, let me think, I always forget which side. Mm-hmm. I think the left side of my breast, my left breast. And like you said in the intro, most people diagnosed with breast cancer really don't have a family history.
Right.
And yes, you're of a higher risk if you have somebody in your family, say mom, sister, who has been diagnosed. But for me, I grew up knowing nobody who had ever been diagnosed with cancer in general, talk less of breast cancer in particular. Mm-hmm. And I was not even in that range, which is considered to be high risk.
Yeah.
So when I did find a lump in my breast, I decided to make an appointment with my primary care doctor, mm-hmm. of which I went there and I told him I found a lump in my breast. And behold, he brushed it out. He told me, well, he checked other things, but he didn't even check that. So he said, most times during your period, your cycle, you could have lumps. Most women do have lumps that do disappear. I actually left his office, went out, and then I said, no, this is not right. I came back and I said, you didn't even check it out. Mm-hmm. He said, well, if you insist. He called his assistant, which was a girl, and came in, and he actually checked it and said, I don't think it's just one. I feel more than one. Mm-hmm. So I was like, okay. And he's like, but I don't think it's anything. But if you still want to check it out, we could send you for a sonogram. I said, of course, I would want a sonogram. Right. So he gave me a referral to go do a sonogram, which then I was doing night shifts. I went to work that night and I was like, no. First, I went to work that night. The next day, I did go for the sonogram, and they told me it's going to take a week for the doctor to have the results. And in my mind, I was asking them, why should it take a whole week for a doctor to have my results? Like, it's a sonogram. You already have it here. Why don't you just email it or fax it or something to him? Mm-hmm. So I thought they were not being proactive enough. So I went to work again the next night. The next morning, I decided to go to the emergency room. So I went to the emergency room and I told the doctor there, I feel this lump. And it is so painful. In my mind, telling them it's painful would mean they would have to do something now.
Yeah.
So I take pictures of everything. So I still have pictures of when I went there and I took pictures. I was in the ER and the doctor prescribed me naproxen for the pain and asked me to go home, right? And on my way out of the hospital, he said, oh, well, if you want to stay, we can check if radiology has a space, and so you can do a sonogram. If you want. I was like, oh, I'll stay. I'll see. So they called radiology and they had no openings that morning. They only had it in the afternoon, which was still not sure. So I told them, I'll wait until they have that opening. So I remember sleeping on the bench at the hospital there, waiting for them to have a spot for me to do that test. I still remember that doctor's name, the radiology doctor. She came in, she was pregnant, and she said, you know what? I'll do the sonogram, but I don't think it's anything. I said, okay. She did the sonogram and she said, oh, I have done this so many times and I don't think it's anything from what I see.
Right.
By the way, you're young, it can be anything. So she said, okay, so you can go home. But I think she saw how worried I still looked. Even her convincing me it's nothing. She said, well, if you want to stay, we could see if we have a spot to do a biopsy. I was like, okay, I'll wait. So I waited again for maybe an hour or so, and they found a spot, and they did a biopsy, and I went home.
Right.
Then I was in school and all of that, and work and all that carried away. Nobody ever called me for a whole month. Nobody called me, and coincidentally, even my primary care doctor never called me for my results for the sonogram. I never bothered following up either. So I kept up with my everyday life. And like we say, no news is good news, right?
Right.
If nobody called you, then it's good. But this is what happened. Because the hospital, I didn't have a primary care doctor there, the results were sitting on somebody's desk. Nobody to call. Who was going to call? Nobody. So one day, I was driving back from school and the doctor called me, the radiology doctor, and she said she want to apologize for giving me all the hopes. She told me it wasn't going to be anything, but she's sorry. It is cancerous. And to me, that was a dream. What's she talking about? It can't be me, right? These are just things that I read in books. It didn't even dawn on me until I got to my destination and I was like, wait, did she say that? And then I started having all this multiple calls from the breast clinic and all that. And that's when it really sank in. Yeah.
Wow. That is definitely not a good story or a good news to hear, especially considering, your worry and the negligence from their part and stuff like that. But I just want to applaud you even for, sharing your story and for your strength as well. And so when they told you that it was cancerous, like what actually was going through your mind? Like, I mean, what was that first? I would imagine that you would never forget that feeling that you had.
I think I was numb because, like I said, it's not me she's talking to. Like, she's not talking about me, right? I was driving when she called me. I can't remember feeling anything. To me, it's not me. Yeah. But when I actually went to my destination and then it only really sunk in when I started getting all these calls from the hospital. Like immediately the breast clinic is calling, the oncologist clinic is calling and like, okay, we need you to come back. But to me, I didn't understand. I didn't process it. It was not sinking. I had to that same day go back to the hospital to see the doctor, to really sit down face to face with her and like, wait, actually, did you just say this?
Wow.
Yeah.
So what were the next steps that you took after that? Like after that diagnosis?
After the diagnosis, I remember doing a couple of more tests. They did another biopsy. They did a mammogram. Then being young, at that point, after me accepting that, okay, this is what it is, my mind frame was, I just want to start treatment. I just want to start, like, when are we starting? I want to get this over with. But it's not that easy.
Right.
There's so many things, especially when you're young and diagnosed with breast cancer. There's so many things that doctors want to put in place to make sure that the treatment is going to be safe for you at the end too. For instance, I had all the options which they'd given me. You have to see a gynecologist or fertility clinics to make sure, like for me, I had the option to harvest your eggs before you take chemotherapy, because sometimes the chemo destroys the female reproductive system. So they would want you to, depends on your doctor. That's what my doctor had wanted me to. And going through the fertility process to harvest your eggs and all of that, it takes another weeks, if not months.
Yeah.
They have to be on medication for those eggs to be. Well, I was like, wait, all of this, I'm fighting to be alive. I have 2 kids. Just get it over with. You know, they have other things that they want you to go through just to make sure life after treatment is not difficult, which now I understand. But then I was like, I don't care what you're talking about. I just want to get this over with. Right. So my treatment plan had to be made, which was I had to do 6 rounds of chemotherapy and no radiation. I didn't have radiation. 6 rounds of chemotherapy, a double mastectomy. That's what I did have.
Wow. Thank you very much for sharing that. We're going to go more into that later. Now, talking about the mammogram, what was your experience with the mammogram?
I'm glad I don't have to do it again ever. Because I don't have real breasts to do it anyway. So It's uncomfortable. That's the truth, right? And I think that's why so many people shy away from doing their mammograms, because it's really uncomfortable for that machine to just press on your boobs and take those pictures. It is uncomfortable. That was my experience. I did it once, and that's what I can remember. So many people shy away from it because of that feeling of being uncomfortable. It's something that is a must. It's not even a question.
People it's not an option. It's like mandatory.
It's not even issue. You have to do it.
And so when they completed the diagnostic process, and from all the tests, what type of breast cancer did you have? And what is the general prognosis from it? Because I know that there are a lot of breast cancers. I mean, breast cancer doesn't just fall under one category. So what kind of specific breast cancer did you have?
Yeah, just like you said, there's so many different kinds of breast cancers. So after doing it was a lot of diagnoses I had to go through for them, or tests. I was diagnosed with HER2 positive breast cancer. That is the tumor feeds on hormones called estrogen and progesterone. So it's called the HER2 positive breast cancer. There's so many, not so many, a few other kinds of breast cancers. So then I had no knowledge I knew breast cancer was breast cancer.
Right.
I didn't think it was going to be, which some are very aggressive than others. Then I got to know, because my doctors were like, well, I think they were just trying to console me. At least you don't have this other kind, because if you but listen, cancer is cancer, but they only have to differentiate these other kinds of cancer, because depending on what kind of breast cancer you have, that's the kind of treatment they're going to focus on.
Right.
Somebody can be triple negative and taking the same treatment with somebody who was HER2 positive.
Yes.
It's going to work. And I think that's one thing me talking and mentoring so many people going through breast cancer in Cameroon in particular. That's a very big challenge, because most people don't even know that there are different kinds of cancer, and they're going through it, and they don't even know what kind of cancer they have. Because I asked them, what kind of breast cancer do you have? Are you going to be going through hormonal treatment after this? Or are you, and they don't know. So I really wonder if our medical professionals in Cameroon are just giving the same. I do really wonder if we are getting the same kind of chemo for everybody, or I don't know. I'm hoping not, because
it may not be as effective.
Yes.
Right. So prior to even this diagnosis, what actually did you think about breast cancer? Like, how aware of breast cancer were you?
The only thing that had helped me is I had done a research in school for breast cancer. And now I just think there were so many things that had happened that God had was preparing me for the journey, right? Out of everything, I had picked breast cancer to write on this research paper. So from that research paper, I had learned a lot about breast cancer, but I still knew nothing about it. I also, when I was in school, I had met this doctor. I had gone for a rotation. He was in the OR, and I had met this doctor, and he was doing a surgery, which he made me join him, and we did the surgery together. He actually showed me through the whole process. But like in the intro, you mentioned that depending on gender, we should check for breast cancer.
Right.
And this is always my thing. I tell everybody, no, men have breast cancer.
Oh, yeah,
too.
men have breast cancers as well. That's very, very true.
So this person we were doing this surgery on, he was a man and he had breast cancer. Yeah, that was eye-opening for me. And I had really seen how the whole process was being done, what they do in the OR. I had helped this doctor suture this patient and all that. And then when I finally actually had a referral for my surgeon, it was the same doctor. So at least I knew what I was getting into.
Right. That's true.
It wasn't that good or bad.
Yeah.
So that was my only two experiences or exposures to breast cancer.
That's very interesting. Two things you had mentioned based on, your research. I just want to give the audience perspective. So you're a nurse, right? And I believe at that time you were in nursing school.
Yeah.
And also, originally you're from Cameroon, the country of Cameroon in Central or West Africa, depending on how you look at it. And like you mentioned, you had no history of breast cancer in your family, no family history, basically. And, no risk factors. You were healthy, strong, nothing. You don't smoke. You don't do any of the things that will increase your risk of getting breast cancer. So like I had mentioned, a majority of women who even have breast cancer, they actually have no risk factors or family history. That's why it's very important for us to really not take it for granted, because breast cancer, like I had mentioned again, is the second most common type of cancer, especially in women. So we have to really make sure that we're being very vigilant and observative of our bodies in general. Now, another thing you mentioned again was about men having cancer. I was going to mention that down in our conversation, but I'm glad you brought it up right now. And yes, there's this ideology in our community, especially in our African community, that just because men don't have big breasts, men have breasts. Everybody has breasts. Every human being has breasts. If a man stands in front of the mirror and someone tells them, point to your breast, they're going to point to their chest, right? The breast. They have breasts, they have nipples. Everybody has. It's just that women have bigger breasts because we have it's part of our reproductive glands. And we have that, to accommodate the secretion of milk, when we actually have kids. But men also have breasts, and men also have breast cancer. So in the intro, when I was talking about, just checking for lumps and stuff, men could also develop those lumps. So it's very important for men as well to check for those lumps, because I believe the issue with men, the breast cancer in men, even though it's not as common in women as in women, is that by the time they discover it, sometimes it could even be too late, because they don't think that they can have it, so it's just something that I just wanted to throw out there. This may be a breaking news for some men, but men actually have breast cancer as well. Now let's talk about the treatment process. I know that you've already spoken about the things that you were expected to do before starting the chemotherapy. So I would like to conclude from basically from what you said, that you literally did not really care about any of those other formalities, especially considering your age. You just wanted to go straight into treatment, correct?
Correct.
Okay, so basically starting treatment and everything, can you walk us through the chemotherapy process and your experience and how that in and of itself affected your quality of life?
If you have ever seen somebody going through treatment of chemotherapy, then you would know what I'm talking about. Even if you see my pictures during that time and me now, two different people, right? Chemotherapy is very, 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 very tedious and difficult. Like this thing actually burns out all your cells, and then your body has to rebuild your cells, which makes sense, right? Tumors are a collection of cells. Chemotherapy is very, very difficult. I did go through 6 rounds of chemo. I think that was every 3 weeks, if I'm not mistaken. And after taking the first treatment, I fell sick, really sick. I got admitted in the hospital. Before I could even take the second treatment, my hair was all gone. My fingernails were all gone. Well, at least like few of my fingernails actually came off. Yeah, my right toe is still actually right now, struggling to survive. Yeah. So chemotherapy is very difficult. No matter how much I tell you right now, you still not grasp it if you've not gone through it or watch somebody go through it. Yeah.
Wow. I would
It
imagine
is a very tough process to go through.
And I would imagine it definitely, took a toll on your body as a whole. And also, even your schedule. Did you have to like not go to work anymore? Like how did it even affect? I mean, back then you were a mother to 2 kids who were less than 10 years old. I mean, they probably did not even understand what was going on with mommy, so I mean, how did that affect your quality of life?
And back then I was in school and I had the kid. It was tough. Actually, after I got diagnosed, I had to make arrangements with school. Actually, my school asked me to actually drop out and come back after treatment because, of course, they understand going through chemo is not a joke.
It's not easy.
They can't expect you to be in class every day at 7 o'clock and all of that. So they asked me to drop out, of which I had stood my ground and I said, nope, I am not dropping out. It was very hard. And at some point I had to drop out and work. No, I had to stop working too at some point because like I said, I became sick. I cannot show up to work every day. Right. Because I was weak, throwing up all the time, having running stomach, and it's just the side effects are just too many that my day-to-day activity had to just go with how you get up in the morning and how you're feeling. You take it from there. Yeah.
Wow. And how did that affect your physical, emotional, and mental health?
That's always something when I think about, I'm like, is it that I've decided to just forget about the bad days and just focus on the positive side of life? My friends say I have a selective memory.
That could be a coping mechanism.
It is my coping mechanism. I'm telling you, that has helped me cope with a lot of things in life, and that especially going through cancer, right? Manu, what was your question again?
Yeah.
Sometimes I do this, right? And honestly, I forget, and then I blame it on the chemo. If you ever heard it, people go through chemo brain.
Yeah.
Where you do forget a lot of things. And I'm like, I forgot it's chemo until now. This is 6 years after.
Right.
One of my friends told me, oh, please stop it. I'm like, why?
Right.
Yes, now I just lost track of the question you asked.
Yeah. So I was saying, how did this entire experience, especially with chemotherapy, affect your physical, emotional, and mental health?
Physically, of course, I lost a whole lot of weight, but I wasn't big anyways. But you could tell I'm pale.
That you're going through something,
Yes. Physically, like I said, I was just going with the flow. It's not like I could do everything that I used to do before treatment. And the whole thing really takes a whole ton on your emotional state. I now remember that, of course, I was thinking at times that what if I don't make it? What happens? But I'm glad that most of the time I knew that I was going to make it. I was not saying that I knew that I was going to make it because I really know that I was going to make it. It's just because my force was to fight to make it. So my whole mind frame was like, I'm going to make it. But I remember questions that I had asked then that now I'm like, oh, I was just feeling defeated. right? Like then I would ask my ex-husband, if I die, what are you gonna tell my kids when they grow up? Like, who was their mom? Like, what would their mom want of them, right? So I did have moments that I thought about it. I might not make it. I'm not special. So many people have not made it, right? So, and then it also plays, this is the thing about cancer, right? I always say the people that really even suffer when someone gets diagnosed is not that patient. Most of the time, it's the people around them. They suffer I will not say the most because they're not going through that pain, but emotionally, the people around you suffer the most. They don't know how to handle it.
Yeah.
They don't know how to help you.
Yeah.
They're thinking,
They're
even
helpless.
because one could be dying. I could have been really looking like I'm dying, but I'm not saying it. But somebody else, somebody who's by me or who's close to me would be like, this person is really dying. Yeah. So I always say it's the people around you that get hit even the most than you, the person who was going through it. I remember once my daughter had said, oh, when I grow up, I don't want to have breasts. Yeah, when I was going through that. And my sister had asked her, why? She's like, because I don't want to have breast cancer.
Oh.
So she was seeing me suffer and she didn't want to go through that as young as she was. Yeah. So it did play emotionally, not just on me, but the people around me. Yeah.
What about mentally?
Mentally, for me or for them?
For you?
For me, oh, my whole perspective of life definitely changed. I think there's so many things that, for instance, would have bothered me then, but after that, I don't think they'll bother me now. I think I told you this the other day that I was reading this book and it said, you only truly live life after you've mastered the act of dying. Yes. After thinking that I have gotten to that place where I could die and I then did not die, that makes me want to live life on another level. At least that's me now. Because even with treatment, you have actually not survived.
Yeah.
We just never survive. Because, like in your intro, the chances of cancer coming back, it's way so high, 60% in the first 5 years. That's a high percentage. So even after treatment, every day you wake up in the morning, you can only pray that you're not going back to your oncologist and they tell you that, oh, hey, I'm sorry, the cancer came back. Even going through all the treatments, cancer, chemotherapy, mastectomy, whatever, radiation, it could still come back the next day after telling you you're cleared.
Right.
So mentally, it does play a role in every decision more than the now that I made. Sometimes I would want to make a decision and I'm like, why am I even doing this? What if I get sick?
Right.
Yeah. So it definitely does play a big role in everything
Right.
around me. Yeah.
Wow, thank you so much. And, going through such a tough time in your life, life still continues, right? Life still happens. And I would definitely imagine, we've had this conversation a lot of times, depending on how comfortable you are sharing it with the guests. But I would imagine, or not even imagine, I know that, life still happened. Things still happened to you behind the scenes. Like you were not exempt from life happening because you were going through chemotherapy or you were going through an ordeal with cancer. So, can you share with us the other things that happened to you in this time and how you how you managed them? I know, with your son who also was diagnosed with cancer, I know for sure that, we're going to talk about that in an entirely new episode. But can you just highlight your strength throughout these trials and tribulations that you experienced during your cancer? I know that during the cancer experience, I know that you have a selective memory, but I would plead with you to dig deep into this, this experiences or this events, because this could literally empower a lot of women who are going through stuff, because so many of us, we go through life happens unexpectedly, things happen, regardless of what else you have going on. And
Yeah.
some people can be facing or experiencing cancer at this point, and then things just get worse and worse, and other like things in terms of like other things that are going on in their lives just get worse, and they feel like they just cannot handle it. But to see you being a survivor of not only cancer but a survivor of life and your circumstances that you went through, it is extremely empowering, even for women who have not even been through half of what you've been through. And it gives a lot of people hope to know that, you know, they can keep pushing, they can keep moving forward, and everything will work out, you know. So can you just share with us some of the things that happened, you know, to you during this very tough moment in your life?
I had a whole 2 year process going through challenges, a lot of so many things. But I always say, looking at it right now, again, in those 2 difficult years, I had so much blessings too.
Hmm.
Like after I got diagnosed, I actually had to drop out of school
Mm-hmm.
because of the diagnosis. But God being so kind, I was called back, and I still passed my exams in that process. I went through a lot of disappointment with some people that I really thought were supposed to be there in a certain way during that process that were not there. Again, like I said, sometimes people around you would just not know how to help you.
Mm-hmm.
And we all have expectations,
Yeah.
right? In that process, even before I finished my treatment, because after chemo, I did have mono treatments for a whole year,
Hmm.
which was still going in every 3 weeks I had a port, which that's how that's the process I had my medications. During that time, um, my son got diagnosed with a brain tumor. That was another journey. Like it was just on, I was not even done with treatment. Then he got diagnosed. A few months later, I went through a divorce. And I think after the divorce, 3 months later, Corey died. And
And
it was
Corey
just
is your
like,
son.
Corey's my son. It was just like on and on and on, something happening, right? I even had situations where people would tell me, somebody had told me this, that is because of my sins, and that's why
My
I am.
goodness.
Yeah, like people would say the weirdest things.
What?
And these are people that would do, like, you're expecting better from them.
Yeah.
Yeah, and such things, no matter how selective my brain is,
You don't
some things,
forget.
some things you cannot forget. Yeah, it was a lot. It was a lot of things that happened, trials, that now I look at them and I'm like, truly they built you to be who you are, your trials. That's really built me to who I am, right? I learned a lot in the process, but sometimes my friends say you're giving people excuses. But no, I just say, you know what, sometimes people just don't know how well to behave or to help in situations.
Right.
But yeah,
Wow,
it was,
wow, wow.
yeah,
I mean, having a child go through cancer or just having a sick child is every parent's worst nightmare,
yes.
right? And then going through such a heavy disease on the child, you know, especially from a perspective of a cancer patient who understands the toll that chemotherapy took on you, your adult body. And I believe, how old was Corey? He was about like, is it 5?
Corey was 5.
Yeah.
Yeah.
So imagine a 5-year old going through that ordeal, and brain cancer actually has a even lower prognosis or survival rate than breast cancer.
Way
So
lower.
from a cancer patient's perspective, having, and also from a parent's perspective, it's like you know what the chemotherapy could do to the body, and then you're also a healthcare professional and at the same time a patient. You know, that's like a triple shot basically to your heart. I can imagine just knowing and understanding what this child is about to face, but then again feeling helpless that you can't take away what the child will be experiencing. That's part of
Yeah.
life, right? That's life that happens. I can
Mhm.
only imagine like, you know, taking away the fact that you were even going through your own chemotherapy and everything, just any normal patient will be, any normal parent, sorry, will be so devastated to even hear that their child is diagnosed with cancer. And then at the
Yeah.
same time, the same people that, you know, your unit, your family was breaking apart. That was like your unit, that was like your foundation.
Mm-hmm.
So I can only imagine what you went through. I mean, you
So
talk about
it
like,
was
so,
a
sorry.
lot. No, I'm agreeing with you that it was definitely a lot. And still in that process, I think I was fighting custody for the other child. And
Yeah.
it was a lot going on at the
Yeah.
same time. Yeah.
Yeah. I mean, I feel like your life is a miracle because to have even
Yeah.
survived that as a
Mhm.
patient, you know, stress is one of the things that really affects our immune
Oh.
system, you
Mm-hmm.
know. And you know, based on my, I would say, my practice or experience, my professional experience, you know, your immune system has to be top notch when going through things like chemotherapy and stuff, because it actually literally attacks the immune system that's supposed to protect you, right? And stress is one of the big factors that actually affects your immune system. So
And I'm thinking of an instance when the social workers in the hospital and the counselors had a meeting with me. And like I said, I didn't think Corey was gonna die. I had so much faith. I just made it, and he was gonna make it, right?
mhm.
But my life was such a chaotic. I would hardly have sleep. I work at night. I'm with him all day in the hospital. I did not even have time to be with Courtney at home if I have to, because driving home to the hospital was an hour away, anyways. I would sleep on the way driving. I have to stop. I usually walk with a bottle of water,
Mm.
sleeping, and I'm pouring it on my head just so not to sleep, right? So I had this meeting with these social workers once, and they were like, when all of this is gone, what are you going to do with your life? Like, they were so scared that I would not be able to know how to cope in the society again
Mm.
because of how chaotic, I was just used to chaos.
My
I
goodness.
was just used to being in a no downtime, being in a chaotic environment that it was like I never saw a day coming that I would just sit and smile.
Hmm.
Yeah,
Well,
like you
I'm glad to
said,
see you smile. And
all the time.
you know, in as much as I wish I could be there, have been there for you at that time, but
Right.
unfortunately, I didn't really know you back then. But I'm
Uh-huh.
glad to share part of your happy years. You know, I mean, everything may not necessarily be 100%. You know, it never is with us in life. There's always something that
Uh-huh.
comes up, but I'm really glad that you know you overcame, because that's something that could literally take a toll on anybody. Talk less of a cancer patient, you know. So I really want to applaud you, and I also thank God for just keeping you through all the storms that you face. So what did you learn about yourself during this experience?
That I was way
Stronger.
stronger than I could ever, ever imagine. Yeah,
Yeah, that is extremely powerful.
but yeah, I'm way stronger than I could imagine. And then to think of it, I always say this sometimes, and people look at like, how would you say that? I think I'm the chosen one.
Hmm.
Yeah, there's no way I could go through everything I went through and the way I went through it and came out the way I did if I wasn't the
Yeah.
chosen one. Yeah.
Yeah. Yeah,
So I
you
learned
know,
that.
your story and even what you just said, it just reminds me, because on social media you're always so jovial. You're always smiling and stuff, you know, and it's very easy for people to see certain things on social media and just come to a conclusion.
Mm-hmm.
Of course, misled conclusion. So it's like
Right.
when you see somebody happy, you see somebody praising God, or you see somebody just living their life to the fullest,
Mm-hmm.
do not judge that person because you don't know what they've been through,
Definitely.
right?
Definitely.
You don't know what
That's
they've been
so
through.
true.
You know, I mean, when I
Yeah.
see you, I'm always happy for you, and I'm happy for anybody that lives their life, because I aspire to be that way. I aspire to really make the most out of life, because one thing that COVID has really taught me specifically is that life can be cut short in any second. So like I've heard so many deaths from COVID that I am at the point of just being numb, that every time I hear that someone dies, I sympathize with them and their family, but I also get that motivation to leave. Like just leave, because it could be
But
you.
that's one thing I said, and I still say it. I remember when I was sick, and somebody would see me and say, "Wait, what are you waiting for?" At least I always say, "No, you're acting like I'm dying, and you're feeling pity for me."
Yeah, sorry for you. Yeah.
No, don't show me pity, because at least I always say, at least I know what is going on inside of me.
Right.
You just don't know what's going on inside of you. There's
Right.
so many people who've been sick and lived forever, and other people who were strong and looking at it like where, and they're dying and they're going and having accidents, or you go out and you just fall down dead.
Yeah.
So I always said, you know what, just live your best life like it's your last.
Yeah.
And don't look at me like I'm dying. Like, wait, treat me like you would treat me any other day. It's true that I've been sick, but let's still go out and have fun and talk about the future, or talk about what if we died today. Because that's one thing that most of us Africans, as a whole, we are shy of talking about death.
Yes, that's very true.
Yes, we are shy of talking about death, but you don't need to have cancer to die.
Yeah.
You don't even need to have COVID to fall down dead.
That's true.
Yeah, so I'm not saying don't help somebody or feel pity for somebody going through something or through cancer, but we all have to live our lives like tomorrow
Today's
could
our
be the last.
last. Yeah.
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 Because if you had asked me 7 years ago, how on earth could I have ever thought that I could be somebody diagnosed with cancer, or even my son? We don't have that in our families.
Yeah.
Never heard of something like that. So you just never know what happens tomorrow. So we really should all do our best, do our mammograms, do whatever we need to do to stay healthy and know our status. Like, that's the main thing. Know it. Yeah.
That's true. So were there like support programs that kind of helped you and other patients as well, especially you who was going through like, a double experience with cancer with you and your son? That really supported you in terms of, like just offering that emotional, mental support, maybe programs established by the hospital and stuff like
America
that.
is a miracle. It is a land, when if you have not been there, you might just never understand. A land of really milk and honey. I remember one of my friends had also said this when I was sick, because I had all this benefits, meaning organizations will actually pay for your rent. There were a lot of programs that had helped me, a lot of programs. And one of my friends had said, why do they glorify breast cancer patients that much? And I looked at her and I was like, yeah, like it's a whole big deal. Like,
well, it is
giving
a big
you
deal.
all this. And I looked at her and I tell you, if I tell you the things that I heard people had actually told me, you'll be like, wow.
That's crazy.
Wow. Yeah, it is crazy. But then she's right. I thought about it and I said, you're right though. But it's for a reason.
Right.
Because there are people that understand that it's hard to even think, okay, imagine you don't have cancer. Just thinking that you're going to die the next minute is hard, and have to go through that process makes it even harder. And that's why I pray God, my whole wishes come through. That's why we do our best. When I say we, I mean my organization, www.warrior.com. We do our best to help as many people as we can in Cameroon, because now what I do is we help people finance treatment. There's so many people that are going through cancer in Africa, in Cameroon in particular, who really just don't even have the money to pay for their treatment. And I don't publicize it a lot, meaning that will come with, we don't have enough funds that like we're supposed to, but at least we do what we can do.
Right.
Sometimes we do the Look Good, Feel Good program because of course, I'm all about looking good most
Good.
of the time.
Yes.
So we do our best to once in a while pop in and give our survivors and people going through treatment, say massages,
Yeah.
and then have programs where they can do their makeup and just feel good someday and have
Mm-hmm.
pictures. Yeah, I do offer those things sometimes
Right.
in Cameroon, and that does live up of their spirits.
Yeah.
It,
Yeah.
yeah,
Yeah.
it
I would
does. It does.
imagine. Well, thank
It
you
does.
so much. I mean, we're going to briefly talk about your organization, Royal Warrior, right? We're going to talk about that later. But, like you said, so many programs that are being offered for breast cancer patients. And this goes especially to breast cancer patients or even cancer patients as a whole here in America to go ahead
Yeah.
and explore these programs and do research
Mhm.
and find out programs that could help you, especially while going through one of the worst times in your life, especially. Now, that also highlights the fact that for some of us in Africa, especially in the African countries where, I mean, I know most African countries probably don't have these resources to support
Yeah.
cancer patients as a whole. That's one of my dreams, hopefully, to really come up with something that could support these patients, because cancer is a very tough disease. I have never had cancer before, but I have seen and I have learned about how tough cancer could take a toll on people's bodies, especially with the treatments. And so I definitely think that if there's one thing to support cancer patients as a whole in our African countries is to give them that financial support and even give them mental or holistic services that for free, obviously, which will help them to traverse the entire ordeal until they reach a stage where they can fend for themselves. So thank you so much for sharing that. Now, I'm not sure how much of the information you can give with this next question, but it has to do with the chemotherapy, right? Because a lot of people, especially in the African communities, they have this ideology about chemotherapy, like, oh, it kills the good and bad cells, and having chemotherapy will make me sicker instead of healing me or whatever, but you're a survivor because of chemotherapy, right? So I was just wondering if you can say anything about that ideology or, versus, let's say, an alkaline diet or Sebi's diet and things like that. Do they also give you like dietary recommendations, to follow through, you know, with the cancer chemotherapy? Or like, what do you think in general of chemotherapy versus like that alkaline route?
I am smiling because I remember when I was having treatment and the doctor had told me not to take chemo.
Hmm.
He's from our African-based community
Hmm.
because chemo will actually kill you. He might be right. Chemo, people are still taking chemo and they die. But his whole concept was that God just pray
Hmm.
and God will.
Oh, wow. A
Yeah,
doctor.
yeah.
Interesting.
So that's why I'm smiling. I've heard it all, right? My whole thing is people have taken chemo and they've died.
Mm-hmm.
And most people have taken chemo and they've survived. I say that because my son took chemo and he died, and I took chemo and I survived.
Mm-hmm.
But it's worth taking that chance while you pray. The other thing is, I don't go out of anything to eat or have any diets. That's not from my doctor. I believe in natural things,
Mm-hmm.
natural remedies, which I have had so many proposals because I went through cancer. Anybody here of anything that they would say treats cancer, they call me first.
Mm.
And it's not that I don't believe in it, but I truly believe in modern medicine too.
Mm.
And this is why, like we said, breast cancer in particular has different kinds of breast cancer. So many different medications are out there, but they're not treating the same thing. You could be proposing me to be on this medication or high levels of vitamin C, which some people said works. And that's not what's treating my cancer. So I have to go with what my doctor recommends.
Mm-hmm.
I'm not saying we should not take holistic things or medications, but for me as a person, I just don't go with that because I had HER2 positive breast cancer,
Mm-hmm.
meaning I want to stay away from things that are high in estrogen,
Mm-hmm.
high in progesterone, in hormones. And there are very little things around the house that are very high in those things.
Mm-hmm.
It could be things that you think it's healthy, but it's not. Say, for instance, soy. Soy is high in estrogen.
Yes.
Yes.
True.
So somebody will be like, drink soy. It's good. It's going to help your immune system. But it's not good for me. So that's the thing with holistic medications. They're good, but when you look at the science behind it, you could be doing more harm to yourself if you don't know what actually you're fighting against.
Right.
Yes. So I always just tell anybody, if you want to take all the bitter leaves and all the things that they give you or whatever, know what's in it. Know what you're fighting. If you know the devil you're fighting, you know what kind of weapon to use.
Right.
Yes, that's the best way out. But for the alkalinity, I remember when I was going through cancer, we actually bought something, a filter that they say would change the water to alkaline base and all that. Well, maybe it works, maybe not, but I just go with what my doctor tells me and do a little more research. And I know if this is high in this and low in that, I'll take that. But I just want to eat everything in moderation.
Right. Yeah. That's true. That's very true. Thank you so much. So, what do you wish you knew before starting chemotherapy?
There's so many things I wish I knew in life before now.
Right.
Before starting chemo, what did I wish I knew? No matter what I wish I knew, it would never have prepared me enough.
Right.
Never. Like some things you have to go through to understand. Even if I knew that my hair is going to fall off, it's not the same thing when my hair fell off. It's not the same feeling when it actually did happen. There is nothing that I would have done differently. There's nothing that I maybe did that I shouldn't have done or did not do that I should have done. I think there's nothing I had, if I knew before diagnosis, that would have changed anything. No, but I learned a lot in the process.
Right, I would imagine.
Yeah, I did. I learned a lot in the process.
So when after the chemotherapy process or the treatment process, were you declared cancer-free?
That's always a good question. Even the doctors, I don't think there's a particular day, right? But this is it. After treatment, after chemo, for me, treatment goes depending on your treatment plan with your doctor. Some people would actually have a mastectomy first or lumpectomy, depending on whatever they are having. Surgery first, then have chemo, then have radiation. Oh, it's switched back and forth. So at the end of the day, depends on the doctor when they're going to declare you free. For me, I did have chemo first, then surgery, and then I had gone through a lot of other treatment, like I said, hormonal treatments. But I think that was going to be the day after treatment. And then after surgery, that is when I did another MRI a few weeks later. And they're like, okay, we can't find anything anymore.
Right. That's wonderful. I know you just mentioned, the surgery and stuff, and you had said you had a double mastectomy, so both of your breasts were actually taken out. And I believe you had like a breast reconstructive surgery, right? Like, how does it feel? I've always been very curious. How does it feel compared to like your boobs before? Do you feel any difference?
My daughter asked me like a month ago, like, why did you have to do that? Why did you have to do a reconstruction?
Right.
It dawned on me like, why did I do it though?
Because I would do it if I were you too.
It was another stressful process in the whole case. I don't regret doing it, but now I'm thinking about it, really, that should have been the list of my worries.
I mean, it's like a boob job, right? So it's not like any different.
That's the thing. It's not just like a boob job. It's different. Imagine, after surgery, I only have skin on my chest, right? They had to actually fit an empty bag inside the skin. Every week, I have to go and they would have to inject a couple of cc's of fluids. Now it's pushing on my skin. Every week, my skin has to expand. That's causing you a lot of back pain, pain. You already had surgery. It's not just a boob job. Like, anyway, you go to do a boob job, it's in and out. It's not like that with reconstruction after mastectomy. It's way
Wow.
different. It's a whole process that takes a year to go through.
Wow. Yeah, that's just an additional appointment to the already multiple appointments you have at the doctors.
Yes,
So I would
a
imagine.
lot.
But I
Yeah.
mean, at some point, I mean, this is like 7 years after. At some point, our skin is elastic, right? So I believe that's why they didn't want to like cause trauma to your skin by just putting that intense stretch all at once. I'm sure that's why they wanted you to come so that when they put a little bit, your skin stretches a little bit,
Yeah.
then they add it
Yeah.
and add it to the required size or to your desired size, right?
Mhm.
I mean, I would imagine that, eventually you don't feel that pain anymore because your skin adjusts, like the elasticity kind of, acclimates to the size of your breast. And then you don't feel that pain anymore. Am I correct?
Yeah, no, like now I don't feel any pain
Okay.
anymore. And yes, even like during the 1 week process to go back, or 1 or 2 weeks to go back to add the fluids, of course, they're expecting the pain to have reduced
Right.
before they inflict another pain.
Oh my goodness.
Of course, then you go through the process again. What I'm
Right.
saying is, it's it's a whole process, and it can never feel like the real ones, right?
Mm-hmm.
I've never said this on social media, but I'll say it. You know what? Let me not say it. Anyways,
Please do. Please do. You heard it here first, guys.
no. Talking about breast reconstruction, I remember I will never forget. This is one of the things that I just will never forget. My ex-husband had told me he can't deal with. He's finding it difficult and can just not deal with a woman who doesn't have real breasts.
Hmm.
That is just one of those things I'll never forget, right?
Right, right. And that could take a toll
Yeah.
on your self-esteem too.
Thank God he never did.
Oh, nice.
Yeah, that
I mean, I would
I,
imagine you were going through way too much anyways to even think of self-esteem at that point, right? You were thinking more of
yeah,
survival.
but that actually would confirm to me so many things. Like if you can't deal with it, it's okay. You
Hmm.
can't deal with it, right? And those are things that will make me actually sleep at peace at night. Yeah, things like that actually make me sleep at peace, with so much peace at night. But what I'm saying is that, yeah, it can never be the same. So many people, so many of my friends, they'll be like, "Can I touch it? Can I feel it?" They actually do ask me that. And I'm like, "Well, I'm just going to be a museum and you're just going to
Right?
pay." Yeah, I'll just make
Like flashing
fun
your
of that.
boobs, like, hey, here you go.
Yeah, it's not the same. It's not that it's hard or anything, but if you have ever felt silicone, it's all silicone, right, on their
Yeah.
skin.
Hmm.
So it's just
Yeah.
going to be soft like silicone. And some people actually go through that and it bursts.
Oh,
Yeah.
and then you have to do it all over
Oh,
again.
if you want, or you just take it off and don't go through that stress.
But your skin is gonna be like flapping, right? Because your skin has already stretched out so much.
It's okay. When you had real boobs, they took it off, right?
Well, I guess.
So this is gonna be very easy for those doctors. They just
Right?
cut the skin and then you go home.
Right, I would
Yeah.
imagine. Well, thank you so
Yeah.
much actually for sharing that because a lot of women, these are questions that people always ask at the back of their minds, but nobody has really had that audacity to like step up and ask a survivor or a
Mm-hmm.
cancer patient, like, how does that, how does that happen? And
So
I'm
many
glad I
people look.
asked,
So many people look at me and they're like, "Wait, you said you did a double mastectomy?" They ask other people. Then how does
Right,
comes
like,
to
and
your
how do you
breast?
have boobs if you
Yes.
cut all
So
your
how comes
boobs,
to have
right?
breast? I'm like,
Right,
just ask me.
right,
So
right,
many people are
right.
just feeling uncomfortable asking me.
Yeah,
Well, they don't want to ask something that's gonna hurt me.
yeah,
So they want to ask somebody who's close to me. And
right.
yeah.
Well,
So I'm like,
hopefully they
it's
wouldn't
okay.
even have to ask you to begin with because they're gonna hear it from here, hopefully.
Yeah.
So since you were told that you don't have cancer anymore, how has your life changed? Have you changed how has your quality of life changed? Have you had any kind of like lifestyle changes? What you can do, what you cannot do, or life has just gone back to normal?
I think after all the years, now I'm saying I'm living my best life ever.
Nice.
I am. Not saying that I'm not living in fear, but I try not to. I'm living my best life every day. That's because I'm scared. I think so. If I want to look at it that way, I'm just living the best life because I know that, okay, that is something that can hit you anytime. Me, especially, I could not die, but I could, God forbid, go through the process again. Yeah, so it has definitely changed my perspective.
Thank you for that. So are you taking any like maintenance medications, or you just not on anything? Or do you have to go to checkups every now and then? Like, what other extracurricular things do you have to do to maintain that prognosis, or at least to maintain that cancer-free declaration?
I have been on medication since the day I started that chemotherapy. And I just don't know when I'm going to stop taking medication to stay healthy, right? Having HER2 positive breast cancer is the only cancer I can talk about because that is what I know firsthand. I have to be on hormonal treatments. This is because maintenance medications that have been made for breast cancer treatment was designed for women of menopausal age.
Yeah.
That is because they believe that women of menopausal age are the ones
Highest
who are
risk.
going to have cancer, right?
Cancer. Yeah.
Unfortunately, today that's not the case. And I still wonder why they haven't come up with better medications that will accommodate people like me who are not of menopausal age. So, coming back to my treatment, for somebody with HER2 positive breast cancer who is not yet in her menopausal age would have to be on medications that will put you in that age group hormonally, I would say, for medications to work. All right. I'm taking medications I'm looking for the right words, to maintain
Or prevent a relapse.
Yeah, to maintain a cancer-free body or to prevent a relapse. Although so many people are still on the medications and still get relapse, but at least science is trying. They can only try. But for me to be on that medication, I also have to be on medications that would put me in a menopausal state. So I asked my doctor once, and I said, "So for how long will this be?" Because when I started this medications, they always say 10 years, right? Say tamoxifen or Lupron or whatever you're on. It's going to be 10 years. And I was 27 then, and I'll be like, even in 10 years, I'm still not going to be in the menopausal circle. What then? So it's just an ongoing process. Get there, then you handle it. For me, I just live every day as it comes.
Right. But are there also some women who have actually been through chemo who can still have kids? I know that the chemotherapy can also attack, the reproductive cycle or system as a whole. So are there still some women who did not harvest their eggs but can still have children post chemotherapy, or is it advised against?
A lot of women do have kids post treatment, and a lot of women don't.
Right.
Again, it depends too highly on the kind of chemotherapy you had. Some of them would really, really damage your ovaries, and some may not do a lot of damage. One thing science also have come about with, even if you don't harvest your eggs, they do have medication, which is something I did take, that you can take before. That's what I did before starting treatment. But you have to take that every month. I did take Gossalarine. If you're a pharmacist, maybe you've come across it or maybe not. It's a needle. The injection is as big as rice. The grain of rice they have to implant every month. That is to prevent your ovaries from chemo. So there are a lot of other options out there.
Right.
You're just preventing your ovaries. No doctor would ever assure you that, take this chemo, you're going to have kids later. So to be on the safe side, they always just ask you, harvest those eggs. I would tell anybody, though, who still plans on having kids before having chemo to harvest those eggs and just save them.
Right. And so talking about life, especially after chemo, right? Or after cancer, has your history of a cancer diagnosis, has that kind of affected your dating life?
Luckily, no.
Awesome. So basically, if you like someone and the person knows that you had that history of cancer, it has not like hindered them from shying away from being with you for fear that, hey, what if she has it again or stuff like that.
On the contrary,
Nice.
I am an open book when it comes to my house.
Mm-hmm.
You don't even need to ask me. If you just go on social media, you know that, okay,
Right.
this is what happened, right?
Right.
It's not something that I could ever hide it.
Mm-hmm.
I have videos on YouTube.
Mm-hmm.
If you just Google my name, like, I hate that it could be my identity, but that is what it is.
Right.
So before I even get to date somebody, most times I must have had chats with them and they want to know my life or know about theirs. And I always want to tell you firsthand, this is what it is and this is who I am.
Yeah, very important.
Yes, it's either we are taking it from here, knowing that this is what it is, or let's not even start this.
Right, right.
So it's always been like that, and I've not had a problem with that.
Right. I'm so glad to know that. So glad to know that. Now, let's basically just quickly talk about your organization and the cause that you're passionate about, which obviously is breast cancer, empowering breast cancer women. Can you talk to us a bit more about Royal Warrior?
Yes, and just to correct you a little bit, I am trying my best not to impact just breast cancer.
Okay.
We're trying to help cancer in general.
Oh, okay.
That's because I have been touched in other ways.
Yeah.
What hit me most is brain cancer. It's not breast cancer.
Okay.
Yeah, that's what hit me the most.
Mm-hmm.
As much as I have a personal experience with breast cancer, we want to help everybody and their families going through cancer.
Awesome.
And life after cancer is also not a joke.
Not easy, yes.
Sometimes it feels better when you're having treatment than after treatment.
Yeah.
Yeah.
I would imagine. So, how can the listeners reach out to you to support your cause, or just to get mentorship advice, or to get your services, or just to ask questions?
We have a website, which is www.royalwarrior.org. You could also visit our page on Facebook. You could contact me personally on Facebook.
Mm-hmm. At what?
Royal Warrior.
Oh, Royal Warrior.
Royal Warrior, yes. And also on Instagram, we do have a page at Royal Warrior. So we have a lot of platforms that you could reach us through. Yeah, but going through the website is the most accurate.
Yeah. And I will have that added to our show notes, right? So I have two last questions for you. Now, what will you advise men and women in our African community going through the ordeal with cancer?
Like I said before, if you know the devil you're fighting, you know what weapons to use. Most of the time, we are not that much educated about what we really have. So know what you're fighting.
Yeah.
Yeah, know what you're fighting. Know what you don't want to face. Like if you're going to have a mammogram, that's because you don't want to have cancer or you want to catch it when it's early. So you know what you don't want to have. So do that. Do all the checkups you're required to do. Or I always say, take your health in your own hands. Be aggressive about it.
Yeah.
Most medical professionals, they're not aggressive. I was aggressive with my health unknowingly. I kept going. I kept being aggressive in a cool way, as always. But be aggressive. Before going to the doctor, know what you want. That's what I said. The doctor's going to give you an advice. Before I go to see a doctor, I tell even my mom, know that your blood pressure is high. Know that you're on 25 milligrams of metropol. I want to be on 50. Can I be on 50?
Right.
Yes. Because sometimes even the doctors in America, they would just be negligent. They can be negligent. But if you know what you want, I remember when I met my son's oncologist, maybe because I had gone through it before, he didn't know me, I didn't know him, but because of the questions and the things I wanted, he had to take time and stop and like, what do you do for a living? I didn't realize I was asking him the questions I wasn't telling him what I want, but he had picked it up because I knew what I wanted. So I told him I'm a nurse. It didn't dawn on me, and he's like, "Oh, no wonder." So I tell everybody, be aggressive with your health. Know what you want before even seeing your doctor. Tell them what you want. Yeah.
Thank you very much for that. And the last question I had for you as well is based on your experience, especially with the support system you had, the support services that were offered you, what will you advise the caretakers of cancer patients in our community, as well as just the community as a whole, when it comes to being more accommodating and sensitive towards cancer patients?
When we talk of caretakers, it's a very vast a place, right? It could be the caretakers from the hospital, caretakers, which most of the time,
family, friends.
Family and friends. When we talk about family and friends, those are the people we have expectations from.
Yes.
We don't have too much expectations from people at the hospital. They're just doing their job, and we know them.
They're getting paid for that, right?
and they're getting paid. Sometimes they'll just not do what they're supposed to do. But when it comes to family and friends, if you have somebody who is sick, keep your own emotions aside. We're born to be selfish. That's okay.
Mm-hmm. And we're emotional beings as well, but we have to learn how to.
Yeah, consider what that person is going through. It doesn't matter how you feel about them. It could be you. Even like, just treat people the way you want to be treated. Again, if you don't know how, ask for help. Ask somebody who has been through that route, who has made it or not made it. Ask them, how did you help this person when they were going through this? I don't know how. Or you tell the person who was sick, if you're a caretaker, hey, Anyo, I don't know how to help you. How can I help you? Honestly, if somebody tells me that, it already tells me how much you care. Right. Don't tell me, like, don't worry, that's it, go.
Right.
You're not helping. How are you helping?
Right.
Maybe that's how we know. That's all people know. That's all they know how to say
it. Right.
Yeah. But just saying, I really don't know how to help you. How can I help you?
Yeah. That's very true.
How can I make you feel better today?
Yeah.
Because I really cannot take this away from you.
Right.
But I want to help.
Yeah. And, that goes to also, address the whole aspect of us using loose words in our community. Sometimes we don't even notice, we tend to get so dismissive about things that happen in our surrounding and with people in our lives that we don't even notice. Like for us or for some people, to them, it's like they're consoling you, like, oh yeah, don't worry. But no, this is such a big deal. Like, I'm gonna worry. Yeah. Like,
there's an elephant in this room,
right?
And you don't worry.
Yeah. So it's like that. I mean, I say this all the time. Like, we have to be very sensitive with the way we speak to one another, especially when we're going through stuff, because loose words like that could literally go a long way. Those are things that people may not even forget. They may never forget that this person told me this, and you never know how those words could get to someone and affect them. So we have to always make sure, if you don't know, ask. And the human nature is we're used to giving love the way we would like to receive it, right? But we don't really consider how the other person will like to receive their love, So it's like what you know is what you give. So asking those necessary questions, like, how may I help you? Because you basically helping someone the way you think is best for that person may not necessarily be best for that person.
Sure.
So it's very important to always ask, like, is there anything I can do for you to help you, so that they can tell you how to love on them, and you would actually make a true impact while doing that. Yeah. So I just want to thank you so much for sharing your story. I always leave empowered every time I speak to you than I came. And I hope that is the same for our audience as well. I know we're going to have so many more episodes with you talking about cancer and everything else. And I so look forward to those conversations, because I feel like your story needs to be in a book. You better be writing that book. I know you spoke about it before, but you have been through so much, and you're not even like you're not even I mean, you're so young, you are so young and you have been through, I mean, your life story. I don't even think my parents have gone through that, I mean, everybody handles their issues
Yeah.
differently, and you showed so much grace in the midst of the storm. You lost a child, you almost lost your life, you lost your marriage. I mean, like, name it, you've been through it, but you're still standing strong. And that's why you're a royal warrior. And I just want to thank you so much for sharing your story. And I hope that the conversation does not end here. I hope that, this conversation spark other hard conversations in our communities, for us to open up to one another, be vulnerable, and talk about things that we will not normally talk about otherwise. Talk about the stories that will really sensitize us to certain diseases, especially non-communicable diseases in our community, which I will really be talking a lot about, because this is silent diseases that, they creep up on your body. You may not feel sick, you may not have a headache. Where in Africa, we are used to having the infectious diseases in the in African countries, right? We're used to having malaria, typhoid, cholera, headaches, fevers, things that you can feel. But hypertension, cancer, cardiovascular diseases, diabetes, these are things that you can't feel. They don't communicate with you. You don't feel a headache. You don't feel, I mean, if you start having symptoms with these diseases, that's when it's actually too late. So these are things that we have to be sensitive about. So I just want to thank you for sharing that story. And here's to many more stories that we're going to be talking about. And thank you for coming once more. It was so great speaking with you.
Same here.
Thank you.
I am humbled and pleased.
I know.
And willing to help in any way I can.
Sure. It's my pleasure. And I applaud you for all the work that you're doing using your own platform. And let me know how I can help in any way. But until then, I will catch you in the next episode. Thank you.
Thank you.
Bye.
Bye.
Living African podcast.
That's it for today. Thank you for listening to our show. If you want to participate in the show or find out more helpful resources, then visit www.livingafricanpodcast.com for more information, or email us at hello@livingafricanpodcast.com. Also, don't forget to connect with us on all social media platforms at Living African Podcast. You can also connect with Anyo directly on Facebook or Instagram at Anyo Fambard. Thanks again for listening, and let's not forget to be more understanding and nicer to one another.